So, a very good evening, everyone. I'm Sal Srivastav, currently studying in UCMS Bhairava in the first year itself. So, I guess I'm experienced enough as I'm into the last semester, like into the very last of my first year. So, I guess I'm well oriented about the first year MBBS. So, today I'm going to talk about like how the first year MBBS is gonna change your life. So, first of all, congratulations to you all if like you have passed one of the very complex entrance exams. So we have competed a lot, so congratulations to you all. But if you are going to think like we don't have to study in the first years or so, you are absolutely wrong, because first year is going to be the hardest. No matter what you think, first year is going to be the hardest in the MBBS, because you are not well oriented, you are not very familiar about all the subjects and how to study it. So I'm just going to lay a basic foundation for you to know what is first year MBBS in Nepal. And also I'm currently studying in Universal College of Medical Sciences, and it is TU affiliated college. So for TU affiliated college, we have three subjects in the first year, which is integrated basic medical science, or what we call it as IBMS, community medicine 1 and community medicine 2. So first of all, let me tell you, just you're seeing just there is three subject only. It's not that simple. So IBMS consists of six subjects in itself, all the basic sciences subject like anatomy, physiology, biochemistry, pharmacology, pathology, and microbiology. So I don't panic, you don't have to study all these six subjects in the first year itself. You are going to study it in 2 years. For example, just like let me take it let me take an example of the neurosensory. So I'm currently studying neurosensory. So I am going to study everything about neurosensory in all these six subjects: anatomy, physiology, biochemistry, pharmacology, pathology, and microbiology. So what happens in India, you have to study anatomy, biochemistry, and physiology in the first year, which means that you have to study everything in the first year itself, all the subject wise. So you have to study three subjects in the first year and three subjects in the second year. But it's not like that in Nepal. We are going to have like six subjects, but we have divided it in the system wise manner. So I think this type of studying is better than that of what you call as the subject wise study. So because you are going to study everything about the drugs, about how the disease is going to happen, what are the organisms involved, and about all the anatomical structure related to that system. So first of all, IBMS in my college, the TU affiliated college, we have one exam of IBMS in one day. Okay. So and then we are going to have moved to our second subject, which is community medicine 1, which is famously known as PSM, or preventive and social medicine in India, which happens in the third year in India, but we are going to have it in the first year, third year, then fourth year. So the major chunk of community medicine, or what you call it as the PSM, is going to be in the first year itself. In the third year or in the fourth year, you are going to have the clinical and the vaccine schedules and all that in the fourth year or third year. Okay. So the major chunk, the harder things are going to be in the first year itself. So community medicine 1 consists of epidemiology, biostatics, and demography. So if you think that maths is going to leave you after 12th or after 10th, you're absolutely wrong, because biostat is there, and it is one of the hardest subject for any medical student, because you are not like you're not liking that maths. But what you can do, okay, it is important for research and all, so we are going to study it. And then we have got the community medicine to health education is there, medical sociology and anthropology, occupational health and environment health, family health and nutrition. So let me tell you all, it is like social studies. If you loved social study, you will absolutely love this subject. There's no if but, it is what it is. So I have just written about two main university, TU and KU. I don't like I'm not very familiar about the PPKHS and the Patan. Okay, so these are the main two universities of Nepal. So in the first year, you are going to study about the general MSK, which is musculoskeletal system, and neurosensory, from like if you are taking a Tribhuvan University affiliated college. And second, like in Kathmandu University, you are going to have that general MSK, which is actually same. And then you are going to have the CVS, which is cardiovascular system, and then the respiratory system in the first year. So let me tell you all, neurosensory is a bulk, okay, is a bulk, but it is going to be in the second year in the Kathmandu University and in the first year in the Tribhuvan University affiliated college. So I'm currently studying in a Tribhuvan University college, mentioning it again. So neurosensory is there. So we moving forward. So if you don't know about the barrier system, we are facing the barrier system this year. So in the first year we have got like 6 attempts to pass and move into the second year. Like if you fail or if you don't give the exam, it is counted as one attempt. Okay, and in the second year you have got 4 attempts. So there's a cram. So if you are thinking like it is easier to get into medical college and like just pass easily, so it is not what. You are going to have a lot of exam, you are going to have a lot of busy days, you are going to have a lot of practicals. But believe me when I say MBBS is worth it. Okay, MBBS is worth it all the pains, because if you are interested in these studies, like in the human human body and all, you will love this particular course. Okay, so moving forward, the first year going to be the hardest, no matter what. Okay, no matter what, because you are not very well oriented with everything, anything, with anything. You are going to face a lot of issues, you are going to face like numerous problems here. So let me tell you, like from all the seniors I have interacted, like they say first year they don't know anything because they are very new. Okay, and just it is like you have, there's a very big gap between the 11th and 12th, and then the this MBBS, cause you are not going to be spoon fed, which was your habit in the 11 and 12. You were seeing video lectures and thinking, okay, you have to read books, you have to read bulky books. Okay, so what are the books to buy? I will make a separate video on this, cause there have been a lot of like controversies, like which books to buy and which not to. Cause see, there are, if your aims are different, your if your aim is different, your books are going to be absolutely different. If you want to go foreign, if you are going to prepare for USMLE and PLAB, AMC or anything else, your books are going to be different in comparison to what you are going to like study in your what you are going to get in your country's exam. For example, INI set, or what you call it, NEET PG, or in Nepal that is the CE PG. But some books, gold standard book, are going to be there. Robbins is going to be everywhere, whether you are studying, whether you are going to study PG in India or Nepal or anywhere else. Robbins is going to be everywhere. One of my favorite books, one of the very good books written in pathology. Okay, so moving ahead. So what are the essential for medical college? Okay, let me tell you, you are very excited. I know, very excited. You are going to be like, you're feeling in the first year everyone feels like they are the best doctor. Okay, but let me tell you, don't buy a stethoscope. If you are getting it like if you're getting it as a gift, it's fine, take it. I have got my Litman as a gift, but it is of no use right now. Okay, so from third year you are going to have your clinical postings. So in the third year you are going to get the use of stethoscope there only. And then moving forward, dissection box. So let me tell you all, you don't need a dissection box. At least in our college we do dissection by ourselves. The faculty teaches us in the anatomy, but we don't need a dissection box. They provide us they provide everything. But in most of the colleges, I know in most of the colleges we don't need a dissection box. So please don't buy it. If your college says, then only buy it. But just don't waste your money. Just invest it into some good book. So the third thing is going to be the clinical hammer or sphygmomanometer. Let me tell you, it is not needed again in the first year, second year itself. When you are going to study the medicine in the for the final year, I don't know. But if when you are going to study medicine, or when you are going to go in the clinical posting, then you are only going to need this clinical hammer or sphygmomanometer. Don't buy it. In the physiology lab, you will be provided by it. Okay, let me tell you again. Okay, let me tell you, let's move forward and let me tell you about the plans we are going to buy. So if you want to buy Marrow, Prep Ladder, Dr. Torius Dams, Dr. Najib, any Kenhub and Kaplan's, let me tell you, all USMLE resources, all the international resources, Pathoma, everything is free on the Telegram. And Marrow, Prep Ladder, Dr. Torius Dams, let me tell you all, first year or second year or the basic sciences year is okay. Like you can do it very well from the YouTube only. So if you don't have that much money, you don't need to buy it. Okay, that simple. But if you want to buy it, you can go for it. I won't I won't like stop you, but let me tell you all everything. The plans are never gonna replace the gold standard book. You have to read the standard books only. Okay, so let let us move forward, and let me tell you about another thing. Is it better to buy an iPad or laptop or some another personal computer, you name any desktop and everything? Let me tell you all, the answer is you can like buy anything. If you have bought a iPad, okay, if you have bought an iPad, let me tell you, after 3 months you are going to say no, I had to like, I was thinking about buying a laptop, why did I bought a iPad, and the vice versa. Okay, so the thing you don't have, you crave it, you crave for it. Okay, so just buy anything. I bought an iPad for video making purposes only, and all this lecture and all are on my iPad. So let just go for anything. Okay, so my iPad helps me a lot in making the anatomy practicals or making diagrams. Okay, so I would say iPad is better. Buy a low end ipad. I have bought the ninth gen. Maybe if I get enough money, I'll upgrade it, but I guess not in MBBS. Okay, so extracurricular activities. There are different programs in your college. You are going to have your community health diagnosis in the first year. So being into a Tribhuvan University college, you are going to like get this 1 month time in the first year only, and you're going to have a lot of fun. The third thing is going to be, you will have enough time for games and all, but you have to understand that you are in MBBS and you are going to treat patients, you are going to treat actual human beings. So try to be consistent in your studies. You might skip 1 2 days, that's not a big deal. You are here to enjoy and study too, but please make sure you study every day. Okay, not for like 4 5 hours according to your capability. You can study for 1 2 hours, you can study, but study consistently. Okay, so now the PG preparation. Okay, this is one of the very good topics, like very confusing topic. Every aspirant is confused. I was also confused. So should I aim for like my own country's PG exam, that is common entrance exam PG, or should I go to USMLE? Yeah, should I do USMLE? Should I prepare for NEET PG, or should like next or NEET PG is going to be the same? We are going to be the 28 batch. We are going to have that next, like we are going to be the first batch giving it. Should we give the PLAB exam or AMC? So let me tell you all, this is not the right time to decide. Okay, I was like, you can make like see, I have that first aid book, which is one of the gold standard book for preparing for USMLE. But let me tell you all, from third year only you have to decide. Okay, from for the first and second year, you are going to have a very like there are going to be different opinions. Okay, so whichever you feel feasible, you should decide it in the third year. Okay, but believe me, when you are like studying in the first year, just have the concept. You have to like know the things, because the concept are going to last for forever. You are not going to forget it or something. So try to study from the first day itself. Try to study before joining MBBS. If you are saying this, I won't say like you have given such a tough exam right now, but I won't say like study from the first day or 0 day itself. But if you want to, please, you can open the BDC zero volume and start studying. I have done that. Please do that. Okay. Oh, God, maybe no, the study life balance. Okay, so let me tell you all, I like generally study a very good proportion, but I do have a life outside studying. I go to watch movies, watch I play games, I play cricket. Okay, cricket, one of my favorite games. And everything, research, everything is going to be good if you're studying. Okay, you should know how to balance your life. There's nothing like a replacement for studies. But see, you will have enough time. Let me tell you all, you are going to have enough time, and you can balance out. The planning and the time management is going to play a crucial role in your MBBS career. So try to have it done. Thank you. That would be all from my side for today. I'm going to make the video on what are the books to be used, because there are numerous books. And so that would be all from my side for today. Thank you for watching, and please mind subscribing. So okay, Thank you and have a good day.